Good morning. Myself Dr. Mrunal Akre, Assistant Professor, Department of Dravyagun, Global Institute of Ayurveda. In our pharmacological series, we are going to see our next topic. It is about anti-helminthic drugs. Now, what is anti-helminthic drugs? The drugs which are used in worm infestation, they are known as anti-helminthic drugs. Many helminths are there. Now we will first see about helminths. What are helminths? Which helminths are infested in the body? Many helminths like roundworm, hookworm, pinworm, threadworm, whipworm, tapeworm are there, which are infested in the body through various sources. Now just like roundworm it is known as Ascaris lumbricoides. In this ascariasis, the drug of choice is mebendazole, albendazole, parental. Then alternative drug of choice is piperazine, levamisole and levamisitine. Hookworm are also known as Ancylostoma duodenale or Nectar americanus. In hookworm we can use mebendazole, levamisole, albendazole, and alternatively we can use parental. Pinworm, it is known as Enterobius oxyrus or vermicularis. In pinworm we can use parental, mebendazole, albendazole, and alternatively we can use piperazine. In threadworms, that is strongyloids, stercoraloids, we can use levermectin and albendazole. In whipworm, that is known as Trichuris trichura, first drug of choice is mebendazole and second is alternatively albendazole. Then other worms infestations are Trichinella spiralis. In that we can use albendazole, mebendazole. In filaria is caused by Vochriffa bancrofti or Brugia malii. In this we can use diethyl carbamazepine, that is known as DEC, ivermectin and albendazole. Guinea worm, that is known as Dracunculus medinensis. This disease is also known as dracunculasis. In this guinea worm, metronidazole and mebendazole are used. Tapeworm are of 4 types, that is Tinea saginata, Tinea solium, then Hymenolopis nana and Neurocysticosis. In all we can use albendazole, nitoxinide, niclosamide and paraziquintel. Hydatid disease means bacteria they form or worms they form a cyst, hydatid cyst, which is commonly caused by Echinococcus granulosus or Echinococcus multiocularis. Here we can use mebendazole and albendazole. Now how anti-helminthic drugs they act. We will see about drugs like mebendazole first. Mebendazole, it is a benzimidazole which is cogner of thiabendazole, which is very popular and have a broad spectrum on anti-helminthic activity. But there is no toxicity seen on precursor. It has produced nearly 100% cure rate reduction in eggs that are laid by hookworm, roundworm and Enterobius and Trichuris infestations. So, it has 75% cure and reported in tapeworm also, H. nana also. It expels Trichinella spiralis from intestine, but efficacy is in killing larvae that migrated to muscle is uncertain. Its use and administration, mebendazole, it comes in 100 mg chewable tablet or 100 mg per 5 ml suspension also. Mebendazole is it can be given 100 mg for 6 days, OD for 6 days. Albendazole, it is a cogner of mebendazole. It has broad spectrum activity and it is well tolerated in the gut. Its single dose administration can reduce many of the infestation. So albendazole, it is given only in children above 2 years of age in the strength of 400 mg once in a 6 month, and below 2 years, from 6 months to 2 years, it is given 200 mg once 6 months. For pediatric use, suspension is available for 200 mg per 5 ml concentration. Anti-helminthic treatment of it is various organs including brain, liver, they are infected by this solium infestation due to migration of larvae from gut in bloodstream and towards the tissue and organ. So to kill this infestation, or to lower the infestation, albendazole is preferred. With albendazole, piperazine is also used. So this was all about anti-helminthic drug. Thank you.